Today, I wanted to talk a little bit about just who I am, my credentials, because a lot of people get it confused. Number one, the American health system is the healthcare system has made everything so complicated. Way back when you just had the doctor, and the doctor talked to you about everything. They talked to you about nutrition. They talked to you about how to, take care of yourself in many ways, sleeping, getting rest, getting, outside, enjoying yourself. And then things just started to fall apart and was kind of dissected. And then you had your family doctors, and then your naturopaths, and then your DOs, and your, specialists, the GI guy, and the heart guy, and the lung guy, and those type of things. And so sometimes people get confused, and they might think that I'm a naturopath, or they might think that I am what we call DO, a doctor of osteopathy, although, that's a wonderful program because they actually learn a whole lot more about taking care of the body in a holistic manner. But I attended allopathic medical school, which means I'm a regular old MD doctor that people traditionally think of as a doctor. I did all the traditional training with medical school, residency as an internist, so I practice internal medicine, which is strictly adults. So we see adults only, but I taking care of people in the hospital, and we had to have our little rotation through the emergency room, and then when I got out into regular private practice, I just stayed outside of the hospital, but definitely spent an entire 3 years of my life, basically almost most of that in the hospital. So that's who I am, what my credentials are, foundationally speaking. After practicing medicine for about 25 years, 20-something years, I was really disheartened. I was frustrated because I'd give people all these medications that we were taught to give people, but they weren't really getting better. Some people felt better and they're like, okay, thank you. But then of course they're tied to this pill all the time. They have no choice but to continue taking it. I didn't know how to tell people what to eat because a lot of people would ask me often, so how do I eat to do such and such? And, I just gave them that, eat healthy foods. Vegetables are good for you, so eat more vegetables. But I couldn't get into specifics. People would also bring supplements to me, and they're like, well, can I take this? And I had no idea. I was like, I don't know. And so at least I was trying to learn. I was trying to learn these things on my own. I bought a book that had, information about supplements and how they interacted with certain medications. And I would also take these different classes. I think the first diet class I took was about the zone diet, basically just how to balance your carbohydrates, proteins, and fats, and that kind of thing. So I would give everyone that diet when I first, met them. Then I kind of investigated the vegan diet. So I started doing all these different things, trying my best, because I knew there was more than just here's your prescription. So when I got sick and had a hard time opening a doorknob because my hands were so painful and swollen, when my knees and my ankles and things and my back was bothering so much I couldn't sleep at night, I bumped into something called, what was it? It was on Netflix. I think it was The Magic Pill. I think it was a documentary called The Magic Pill. And in that documentary, they mentioned somebody saw a functional medicine doctor. And I immediately said, what kind of quackery are they talking about? It's like, what the heck is a function? I've been doing this for 20-something years. I've never heard of a functional medicine doctor. That's not a field of medicine. What the heck are they talking about? So of course, curiosity gets the best of me, and I Googled this functional medicine thing, and I came across the Institute for Functional Medicine. And then I started reading a little bit, and they had some free classes. So I said, okay, let me see what the heck they're talking about. And then I really felt crazy because I don't know, it was just one of those, oops, I put my foot in my mouth kind of situations, because I was like, this is how medicine's supposed to be. Now, the Institute for Functional Medicine doesn't just train doctors. They train nurse practitioners and, other people too, chiropractors and, all types of fields, that are in the healthcare system. But that's where I learned how to tell people, hey, this type of diet is good for your heart. This type of diet is good when you have a nervous problem like nerve damage. This type of diet is good when you have an autoimmune disease. So I started learning that type of information. And it wasn't that I threw prescriptions out of the door, because prescriptions are necessary. I mean, again, you fall off the roof and you break your leg, good grief, you want a good prescription to help you with that particular kind of pain. Or, you know,
a supplement would not be.
Yeah, you know, it probably won't be good if I just tell you, ooh, take a little Boswellia and, you know, wait for the fracture to heal, or, you know, do like back, you know, and way back in the day, well, bite on this stick while they do your surgery. You know, that kind of stuff isn't going to fly. But so medicine definitely, those type of medications definitely have their place. But for chronic long-term stuff like diabetes, high blood pressure, you know, these things, heart disease that are bothersome over years and cause damage over years, just popping a pill really isn't good enough. You need to have some way to treat your body the way that God designed you to treat your body, so that it can respond properly. You know, as you know, we are fearfully and wonderfully made, which is where wonderfully med came from.
That's our name.
But the thing is that, again, you treat your body right, it will treat you right in return.
Yeah. So you are not throwing away your training as a doctor.
No.
That is still useful today.
Definitely.
But then what functional medicine did to you professionally? What happened there?
It opened the doors. It widened my knowledge. In fact, I had one patient who had to go see her cardiologist. She already had some issues and she needed to go see her cardiologist. And when she went to the cardiologist, she said, yes, I'm also seeing a functional medicine doctor. And the cardiologist goes, well, we speak a different language. You know, I don't know about it. She doesn't know about it. No, actually, I do. I speak your language. It's just that, hey, maybe my vocabulary is a little more extensive when it comes to lifestyle. That's all I can say. I was like, no, I understand perfectly. I am still a medical doctor. I don't throw that stuff away and only tell you, you know, to eat broccoli every day to heal everything. It's just that now I can give you something that's going to be long lasting, that does not have side effects, because for most people, broccoli doesn't have a major side effect, maybe a little gas for some, but you know, I can give you those things, and hopefully that will make a change before you even need a prescription. We're trying to prevent these things from getting to the prescription point, and I didn't have that in my arsenal when I first came out of medical school. I only knew prescription as the first line therapy.
It's amazing to me. This might sound a little off field, but I have a lot of background in martial arts, and in martial arts, you see this jealousy among each other, or this war among each other. Where Taekwondo is the best, and Shotokan is the best, and Kung Fu is the best, and this and that, and maybe because I fought a lot on the street, I realized that everything is useful. But you realize that you can grab something good out of each one of these styles, and depending the situation that you're in, you can use this style of kick, and the same thing when it comes down to medicine. You know that we are not enemies of the traditional medicine. Now we might be in a situation we might become enemies of the system, because the system is a whole. We need to record a whole different video just about the system.
That's a whole nother story.
But
for sure.
I have run into so many good doctors that have good intentions. They cannot go any further. They cannot go into the lifestyle. Some of them, they cannot even talk about these things. Am I right? Their license can be at risk.
Yeah, I guess when you talk about things that are not what they call the standard of care. So all of these different medical societies come up basically with what you would call a rule on how to treat a disease. You have high blood pressure. They do mention lifestyle. They same thing with diabetes. They mention lifestyle. The only thing is that we weren't trained in how to actually instruct you in that lifestyle. So they'll say, yep, you want to do lifestyle changes, diet, exercise, and then you want to give this medication or that medication or this medication. And in some cases, we are actually given credit when we get to certain number of medications. If someone has a disease, then they should be on this medication. And you get points for that, you know, for lack of a better word. And if they're not on that medication and they have something, and that's, you know, unfortunately, like diabetes is the prime example. If you're diabetic and you're not on medication that's supposed to help your kidneys, and you're not on something that, you know, can perhaps help protect you from your cholesterol going up, you know, you can get certain little marks against you. And unfortunately, some people can get in trouble in their job for not having people on medications like that. It really doesn't necessarily matter how well controlled your diabetes is all the time. If you're in that middle stage, you know, not as important, but once you kind of cross that threshold and have this full-blown diagnosis of diabetes, if I taught you how to eat well and do fine and your numbers got better, they would still say, oh, but they're not on this medication. And that could be a mark against me.
So then there is this little, I don't even know how to call it. It's like for the traditional medicine, the doctor is almost trained to keep folks, you know, good enough, but still on medication, and they get rewarded for that. While a functional medicine doctor, his or her passion is actually to either get you off medication or to have less medication as possible.
Yeah, and
that's
really,
their passion.
Yeah, really to prevent it in the first place.
Prevent it, yeah.
If we are able to intervene early enough, then we can prevent a lot of these things that are happening. But yeah, once you do see someone, a lot of us, our goal is to hopefully minimize the number of prescriptions that you have, because there isn't any prescription that doesn't have a side effect. You know, people will quite often, oh, I don't want to take XYZ because it has a side effect, you know, a prescription medication, but I have to remind them, Tylenol has side effects, aspirin has side effects, you know, all these things that are over the counter that we kind of blow off, they all have side effects. So that's the beauty of lifestyle changes. And when you're talking about the different styles and different fields, it's so funny, you know, there's this functional medicine field, then there's the integrative medicine field. And I've taken classes and have, you know, taken the tests and things like that. Then there's lifestyle medicine. So we have all of these different societies that sometimes, again, they kind of go, my way is the best, and my way is the best, and my way is the best. When the ultimate goal is to get patients better without medication. That's everyone's goal, to minimize medications. Everyone's goal is to say, hey, eat a healthy diet. And again, you're going to have those, vegan is the best, vegetarian is the best, carnivore is the best, keto is the best, Southwest is the best, you know, Mediterranean is the best. You know, we're going to always have these little, you know, I'm team Mediterranean, I'm team carnivore. But it's silly, because number one, at least for us, we look at things from a biblical perspective. And in the Bible, there are several different types of diets.
Yes, absolutely.
And they apply in different situations. And then there are other times, like in just normal society, people have access to different foods according to the regions in which they live. People can afford different foods. So everyone's diet cannot be the same. Everybody's got different genetics. None of that stuff can be the same. But the ultimate goal is for people to have real food. The ultimate goal of this integrative, functional, lifestyle medicine system is to have people get better without prescriptions. The ultimate goal for the entire healthcare system, prescription people include, you know, at least from the doctor's aspect, most doctors want you to feel well. We want you to get better. It's just that the way that people do it differs. And unfortunately, some of those ways aren't as permanent and long-lasting as we want them to be.
As we begin to close this video, there's one thing that I have witnessed you doing, and is that many times we have clients coming in with a whole bag of different kinds of supplements. I have never seen this many supplements in my life, and these are clients that want to get better. They don't want to be on medication, but then they overload with supplements. Now, we can sell them a whole bunch of supplements and make money out of it.
Mm-hmm.
But you're very clear in telling these clients that the ultimate goal is to even bring them out of these supplements, that they can eat real food, right?
Yeah. The ultimate goal is to hopefully have you prescription free, supplement free too. There's a lot of people, like you said, they have all these prescriptions and they're like, I just want to stop prescriptions. I'm tired of them. What supplement can I take? So you exchange one duffel bag of prescriptions for a duffel bag of supplements. And that's not appropriate.
Mm-hmm.
We want you to only take supplements that you need. And I only want you to take supplements that are going to be safe for you.
Yes.
I only want you to take supplements that your body absolutely cannot be optimal without. And if in turn you need to eat a few extra almonds a day to get that particular nutrient, eat the almonds.
Yeah.
I don't want you popping a supplement. One quick example is like the thyroid. People need selenium for their thyroid to function properly. You can eat about 2 Brazil nuts a day and you've got the selenium you need. You don't have to pop a pill, and you get it from a natural source. Our bodies handle things from natural sources better.
Mm-hmm. Yep. So there you have it.
Yep.
Dr. Casiano, Counselor Angel Casiano, we are in the business of restoring people to wellness. God bless you. Love you guys.
God bless.